Let's talk about Parkinson's disease. In particular, we're going to focus on the symptoms today. Guys, I'm Dr. Jen. It's good to see you. Now, you should just have a little backstory, okay? Parkinson's disease is a movement disorder of the nervous system. It tends to get worse over time, and Parkinson's disease affects a part of the brain called the basal ganglia. Now, remember that symptoms for most conditions can vary from person to person. With Parkinson's, it's the same. Often symptoms in the beginning are mild. Sometimes we don't even notice them initially, and then many times they get worse. And the other thing you should know is that sometimes Parkinson's symptoms actually overlap the symptoms of other diseases and conditions. One particular symptom is a tremor, okay? This is a shaking that typically happens in the hands or fingers. It can happen in other parts of the body too. But there is a particular type of tremor called a pill rolling tremor, where the patient may rub their thumb and forefinger back and forth like this. Pill rolling tremor, okay? And also tremor may happen at rest or when the person is under stress, okay? Another thing that we see with Parkinson's is slowed movement. It's called bradykinesia. So Parkinson's disease literally may make your movement slower. Everything is slower. Also, muscles tend to get rigid, okay? Stiff muscles. Muscles may feel tense or painful. And then arm movements also may be short and jerky as well. And something else we often see is the posture. Posture becomes more poor. Sometimes people get more stooped over, and there may be like falls or balance problems as well. And then another thing that I think is sometimes really compelling is that oftentimes with patients with Parkinson's, they'll have what we call like a masked facies, meaning they may not blink a lot, they may not smile a lot. We may not be able to sort of tell their expressions kind of flat. And some other automatic movements may not happen, like swinging the arm just may not happen when people with Parkinson's actually walk, which I think is kind of interesting. There are many other potential changes, speech changes, right? So speech may change, become soft, become hesitant, maybe monotone without typical speech patterns. And then along with that, of course, we can get writing changes, we can get non-motor changes, depression, anxiety symptoms, sleep problems, just different things really can sort of affect a lot of aspects of a person. As I mentioned before, Parkinson's disease affects a part of the brain called the basal ganglia. That's the area that starts to deteriorate, and that's one of the reasons why we see a lot of the symptoms that we see, okay? You're probably wondering, why does this happen? Well, it's likely a combination of genetics and environment and other idiopathic factors. There's no cure for Parkinson's disease, which I'm sure is something that you're wondering, but we do have medications that can help, maybe help the symptoms. In some patients, surgery may be an option as well as potentially other treatments. What I want you to know is that if you or a loved one of yours has symptoms that you don't understand, that's a change from their normal or baseline, this is a sign for you to see your doctor, to take them to their doctor. Write in the comments below if you're familiar with Parkinson's disease, if you have a loved one who has it or are familiar with it for any other reason. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Please like and follow my page. Please subscribe to my channel on YouTube. I'm on TikTok, Instagram, WhatsApp, LinkedIn. Follow me there, and also go to my website to sign up for my free health newsletter, drjencaudle.com. Guys, love y'all.